Hi, I'm Dr. Beth Molleson.
And I'm Dr. Alyssa Watson.
Thanks so much for joining us here in the Veterinary Breakroom. This is where Dr. Alyssa and I just have informal conversations about various topics in vet med. And today we're going to talk about what feels like maybe a big topic, and that is vaccine hesitancy. I want to sort of level set by sharing the definition that the World Health Organization uses for vaccine hesitancy. And they say that it is the delay in acceptance or refusal of vaccination despite availability of vaccination services. So that makes sense. Obviously, if you don't have access to the vaccine, you can't be considered having vaccine hesitancy. It was named a top 10 threat to global health in 2019 by the World Health Organization, which I thought was really, really interesting. Obviously, that's sort of not just from the veterinary perspective, but in terms of human health and global health in general. Subjectively and maybe objectively, I think that's maybe only gotten more severe since the COVID epidemic. I think a lot of issues, as everybody knows, have been raised around vaccines. A lot of big spotlight has been shown on vaccines. Sort of vaccines, as we all know, have been politicized in many ways. But we just sort of wanted to talk about, what have we experienced as general practice veterinarians? Obviously, a lot of what I do, I know Alyssa does a lot of in-home euthanasia, but in general practice, I, of course, do a lot of vaccines. A lot of our appointments revolve around vaccines. So I wanted to talk about our experience. But Alyssa, I know obviously you have been in general practice. You've been in general practice for, dare I say, a few decades. Is this something that you feel like—
Thank you for that, Beth.
That's just a subtle shout out to your decades of work. But I guess I'm curious. I mean, let's be frank, I've been in practice almost decades myself. Mm-hmm. And I was sort of, when we talk about this topic, trying to think back and see if I've seen a big change in the last 5 to 10 years and how pet owners have approached vaccines. But I'll ask you first. Do you feel like this is vaccine hesitancy is something that you have dealt with from many pet owners? Has it changed over your career, or what has your experience been?
So I would have to say, when you asked this question, it got me thinking. I feel like vaccine hesitancy goes back, at least in my career, even further, than the last 5 to 10 years. I feel like I was starting to see that when I first started practicing, in the early 2000s. I definitely do think that it has gotten worse. However, I would have to say that I see more issues about it online than I see when I'm actually in the exam room with clients. And I think, that's one of the things we're going to talk about is where do clients truly stand when it comes to trust from their veterinarians, and how can something like, social media and the internet kind of amplify these concerns that maybe, we actually have a little bit better window into, our clients' mindset and into and being able to, help them and influence them and talk them through some of these concerns than we sometimes think we do. Because if you just look at social media or scroll through the internet, it seems like this losing battle. And I'm not sure we're really there, I don't know. What do you think?
Yeah, I think, exactly when we decided to tackle this topic, it really had me sort of reflecting on what I have seen in the exam room. And I do feel like my observations are similar to yours, where I think if we spend any time on social media or reading headlines, obviously it is a major problem, but I feel lucky that I don't feel like I have seen huge dramatic shifts over the years. I think, and we'll get into this too, about this idea of vaccine hesitancy being a spectrum. I feel like see very few people that come in with super strong rhetoric about how they don't trust vaccines and sort of that complete resistance or refusal to have their pets vaccinated. I actually think, if I'm reflecting on it, what almost happens more often is it almost feels like sometimes it's more of a financial issue. And in thinking about it, I'm wondering how many times maybe a pet owner has declined vaccinations, sort of citing financial issues, but maybe there were more deep-seated issues, concerns, or lack of education behind that. I have worked in a practice that has sort of comprehensive preventive care plans. I think that has helped me maybe avoid vaccine refusal in a lot of situations, because I think it's a lot easier conversation to have when all of those things are sort of bundled and included. But I did attend it. One of the things that got me thinking about this is I did attend a roundtable discussion at VMX that Alenko hosted, that had some experts in the field discussing this. And they did share, of course, this is a topic that has been studied, not just globally in human health, but also in veterinary medicine itself. And they had some interesting insights that they shared, sort of a compilation of study data that has come out across several studies has sort of showed that most clients do trust their veterinarian, and that is one of the things that we really have working in our benefit, is that long-standing veterinary client relationships are and have been proven to be strongly associated with vaccine acceptance. So I thought that was really interesting, and maybe some of what we've seen, Alyssa, where when we have these strong relationships in the exam room, we are more likely to sort of not face the resistance. When they look at what pet owners truly are worried about with vaccines, or some of the reasons they are hesitant, the most sizable subset of clients had concerns about safety. Some had efficacy concerns, some had risk of adverse events. And one of the big things they touch on was really lack of understanding the risk, which I thought was really interesting. I know I've been guilty many times of just saying, oh, this is the lepto vaccine, we should give it. And I'm thinking, like, people don't even know what that is. And if you don't know what something is, or you're not aware of the risks, how much harder it is to sort of have universal acceptance of a vaccine.
Yeah, I definitely think that you're right. I think today's clients they want more information. They expect more information. And that's hard because a lot of us don't have, a lot of time in the exam room. But being able to, like you said, educate people as to why what these diseases are, what they do, and how these vaccines are going to protect not only their pet, but also in some cases, like we had this conversation, several weeks ago when we talked about the rise in rabies cases that we've been seeing in the United States. So not only protecting their pet, but also protecting the public and their family, from some of these diseases. Lepto is a perfect example. And so I think definitely gone are the days, like you said, 20 some years ago, when I would come into the room and just say, these are the vaccines we're giving today. And everybody just accepted that was the case. I think also it's important to acknowledge that, as our profession has changed significantly in the past 20 to 25 years in the frequency of vaccination. I mean, it was not uncommon when I first started practicing that these pets were getting vaccines every year. They were getting their
Mhm.
distemper parvo combination shot every single year. And we know that wasn't necessary. And so to acknowledge that science progresses, we learn things, we adapt, but it doesn't mean that, the vaccine is not safe,
Right.
and so, but also to acknowledge that, because I can see from a client standpoint how that could be confusing or cause pause.
Right. Right. Not being overly dismissive of some of the hesitations they do have. And like you said, things change, our protocols change, vaccine technology has certainly changed. As I was looking through the rates of adverse events, it looks like the statistic that was quoted was about 52 dogs or 52 cats out of 10,000 have vaccine adverse events, and 19 out of 10,000 dogs have adverse events from vaccines. So, some clients, I feel like, even appreciate that sort of data or information or statistic to help them understand what we're talking about here. Another really interesting, I felt like, tangible glimmer that I got from this roundtable discussion was this idea Dr. Jessica Pritchard talked about presumptive messaging. And this one really hit home for me. It was sort of one tangible thing we can do is, I know we're guilty of this sometimes in the practice I've worked at, is walking in, sort of giving a line item by line item cost of each vaccine, not giving much education about what we're protecting against or vaccinating for, and just saying, do you want these? And I think in that scenario, it's really easy for pet owners to say, I've never heard of lepto, I'm going to save $32, and say no. And she talked about, again, this idea of presumptive messaging, where we say, here's what we need to protect your pet for against, here's the grand total, instead of sort of giving them the opportunity for easy refusal. And I thought that was really smart. Of course, I'm sure a lot of us are already doing that, but I think that's an easy way for, again, going back to that spectrum of pet owners and where they might fall on vaccine hesitancy. I think those ones that come in saying, no, I don't believe in vaccines. I don't trust them. I don't think my pet's at risk. Anybody that's on that far into the spectrum, I think is going to be really hard to reach. But I think for a lot of those pet owners in the middle that maybe aren't aware of the risks or have a little bit of hesitancy but do trust you, those are the ones that I think we're going to help be able to better protect their pets with that sort of presumptive messaging type approach.
Yeah, I agree. And it's hard because you don't want to dismiss people. You want to try to reach as many people as possible, but just like you said, it's going to be a lot harder to sway that person that off the bat is very anti. And I've had a few over the years that come in and they walk in the exam room and the first thing they say is, just so you know, I don't vaccinate my dogs. Or sometimes they even say, I don't vaccinate my kids either. And I'm like, okay. I mean, that's a conversation I think you should probably have with your pediatrician.
Exactly.
Let's focus, on why you felt it was necessary to so forcefully tell me that,
Mm-hmm.
and like you said, we might not be able to change. I think it's important from that standpoint to have have this conversation within your clinic with the doctors and the staff at your clinic. What is your protocol? Are you going to see pets that are not vaccinated for, things like rabies or diseases that could potentially cause risk to the staff? And I think it's
Mm-hmm.
very appropriate to say, you know, if a client is refusing to give those vaccines, that maybe you need to find a veterinarian that better fits your needs or your view on these things. But that's a conversation that should happen, in clinics across the country so that everybody can be on the same page.
Right. Yep. And it's a tricky balance because certainly there are some things, and obviously, if we're talking about rabies versus maybe a different disease, we've got different stakes there. But on the flip side of that, it's sort of like, how do we make sure? I feel like one of the key things is trying to make sure that we maintain trust, even if a client sort of does decline a vaccine. It's like, how do we not pass judgment? How do we keep the lines of communication open? I think for some people, maybe it's going to take more than one conversation where it's like, maybe we made strides in this conversation. That doesn't mean we're doing the vaccine today, but we've maintained trust. And when it comes up again in future conversations, maybe the outcome is going to be different. So yeah, it's tricky. I think just like so many topics in vet med, it requires a lot of empathy, a lot of sort of trying to understand where people are coming from, requires a lot of time to have these conversations, which I think we don't always have, which is tough. One of the other things I wanted to ask you, Alyssa, is this got me thinking, and you just sort of mentioned it with that client that came in talking about their kids and their kids' vaccines, but it got me thinking a lot about how my pediatrician handles this. And one, it made me think about how much, at least my suspicion is, easier maybe we have it. I don't know. I'm curious to hear what you think. I almost feel like even though this is an issue in veterinary medicine, it maybe has not been politicized or as prevalent as it might be in the pediatric landscape. And so it just had me really feeling for my pediatrician and how they handle these vaccines. I know they have used presumptive messaging many times when I've been in, where it's sort of the end of the appointment. It's okay, here's your kid's going to get some vaccines. We're going to walk them in just a second and then we'll be done. But I don't know. Did it get you thinking about any of those things?
It actually did. We had I had an appointment for both of my children not that long ago, and my oldest is just turned 18, and so he'll be going off to college, and I think it was the meningitis vaccine, but it was kind of the same thing. And it wasn't even, my pediatrician, it was the nurse that said, you can do this today. Do you
Mm-hmm.
want it? And I was like, well, can I talk to the doctor about it? And then I felt
Mm-hmm.
so bad because he came back in and it was just like deflated. He was like, oh, and I think I think he expected me to be more
Sure.
hesitant and be, accusatory. And really, I was just seeking information. And I just,
Right.
and I said, if you believe in it and you think he should have it today, that's what we're going to do. Um,
Right.
and
Right.
so, but yeah, the look on his face made me feel really empathetic. And then I kind of
Well,
felt bad that I asked to bring him back in the room.
but I think it's a good call out, because it shows that even that your communication style really matters. I could have seen myself responding exactly the same way, despite being self-described as very pro-vaccine and trusting of vaccines. I think I would have like looked at the nurse and said, I don't know, tell me what I'm supposed to do, or tell me what the science says I should do, or what the doctor recommends. So I think that just goes to show, like, hey, our messaging around this as practitioners, and same with our support staff, a lot of times they're the ones that talk about vaccines first with our pet owners, is super important. And this might be a good reminder, if we haven't recently, to sort of have that refresher conversation with our support staff of how are we having these conversations, because it really can affect the final outcome.
Agreed. So, Beth, you said you went to this roundtable at VMX, and I know you were also at WVC recently. Since I saw you there, what do you have any other like big fun wins since I saw you recently?
Yes. Well, I would say those are two major wins. Love conference season. Always so fun to sit in on some CE sessions, of course, see lots of colleagues. I'm going to keep my other big win of the week on topic here, and that is going to be that I survived a birthday party at Chuck E. Cheese. The theme being infectious disease, of course. But yeah, that was my son turned 5, and we had a successful birthday party at Chuck E. Cheese. I'm not kidding when I say that is a big accomplishment for me, because I do hate germs, and places like Chuck E. Cheese are my worst nightmare for many reasons. But I was really proud of myself for sucking it up, doing it for him. We actually had his party like before the official Chuck E. Cheese hours opened, which was fantastic. So we were basically the only ones there. So I guess I can't be too proud of myself. But no, it was super fun. I hadn't been there since the 90s. So shout out to Chuck E. Cheese. I would do it again. It was that successful. So that's my other win of the week.
Awesome. I love it. You love Chuck E. Cheese.
Yeah, well, who would have thought,
Yeah.
Anyway, what about you? Any wins this week, other than, of course, like you said, the fact that we got to see each other?
We did get to see each other. It was absolutely wonderful. Actually, my win is definitely related to the conference. So I actually really needed CE. My license renews in a couple months, and I needed some CE. So I actually took some days off work, which I normally don't do for WVC because I live here in Vegas. And so then I'm just like popping in around other things, around my work schedule and running back and forth downtown. And I actually took the time to go to WVC and go to lectures. And I went to some fabulous lectures, fabulous lectures, especially some on ketamine and pain management. And so that was my win, just to actually go to a conference and really focus on the conference and not try to fit it in around the rest of my life, which I usually do.
Right. Just getting to slip back into that. I feel like I'm always in like vet school mode when I go to the conferences where you're just lecture after lecture. But anyway, Alyssa, well, I appreciate you joining me here in the break room today. To our audience, thank you so much for listening in. We will catch you all next episode.
Thank you for joining us in the Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts. Or drop us a line at podcasts@instinct.vet. Veterinary Breakroom is an Instinct Science production, produced by Alexis Ussery and co-hosted by Alyssa Watson, Beth Molleson, and Katie Berlin.